When I heard that the hospital was looking for staff to come back, I picked up the phone and called Human Resources at the hospital, and I was hired within 3 hours, and I was back to work within a week.
In the middle of a pandemic, when healthcare workers are risking their lives on the job, Robin Morash gave up retirement and went back to work.
I wanted to help out in my community, and I couldn't sit at home while COVID was starting up in our area.
Robin is one of a group of 4 Ottawa nurses, all friends, all retired, who rushed in to help. For Jennifer Smiley, the decision wasn't easy.
I think the most stressful and difficult part was talking to my family about it. I think it was a little bit of worry for some of my family that I was going back into a hospital.
Hospitals are where healthcare workers across the country have contracted the disease. But for Barb Byman, they're still where she wants to be.
When I was 6, I was in the hospital. I had surgery. I don't remember much about my experience except for the nurses that were just really kind, and it was just what I was going to do. My parents tried to knock it out of me, but I just kept doing it.
And here she is, despite the risks. And Jennifer, too. In fact, she might have one of the toughest assignments in the pandemic. Imagine being retired, and then you're at the door of a hospital controlling who gets in.
The most challenging part of my role at the moment is speaking to families or friends or neighbors who all want to come in and see somebody at the end of life, for example. It's not normal, right? We're in a new normal in the hospital, so it's not unlimited. So that's very challenging sometimes. It's difficult for people to understand.
Jennifer says it's her experience that's needed today, and that's why nurses were pulled out of retirement. Take Lynn Rostelli. She's faced down deadly diseases before.
I've worked through SARS, I've worked through H1N1. This is definitely at a larger, more serious, more contagious pandemic. But I just felt that kind of experience would go a long way in helping others during this crisis.
Back in the 80s when HIV happened, we didn't know what caused it or what to do about it, and so I worked through that. So I think having that experience gives me more of a calmness in my approach.
At some point, these nurses will do their last shifts and head back into retirement, but they won't be the same.
I think I've learned about myself that I'm still up for a challenge.
Since coming back, I think I've learned about myself that I am resilient and that we are all in this together.
I think it's a profession that we carry with us throughout our life, and we're always a nurse, no matter whether you're retired or not.
Nick Purdon, CBC News, Ottawa.